Hello and welcome. Today, we're diving deep into a specific type of heart disease, infectious pericarditis. We'll explore what it is, what causes it, how it affects the heart, and what can be done to treat and prevent this condition. So, let's get started. Infectious pericarditis occurs when an infection invades the pericardium, the sac surrounding the heart. The most common culprit is viral infections. Viruses like Coxsackie virus, Acavirus, and adenovirus are frequently implicated. However, bacteria, fungi, and parasites can also be responsible. Bacterial infections may arise from pneumonia, sepsis, or even tuberculosis. Fungal infections are less common but can occur, especially in individuals with weakened immune systems. Parasitic infections, while rare, can also contribute to the development of infectious pericarditis. When a pathogen infects the pericardium, it triggers an inflammatory response. This inflammation leads to swelling and thickening of the pericardial layers. The increased fluid accumulation in the pericardial space causes pericardial effusion. In severe cases, this fluid buildup can compress the heart, restricting its ability to pump blood effectively. This compression is known as cardiac tamponade, a life-threatening complication. The inflammation and fluid can also cause friction between the pericardial layers, resulting in chest pain. The exact epidemiology of infectious pericarditis is difficult to determine, as many cases may go undiagnosed or are attributed to other causes. Viral pericarditis is likely the most common form. It tends to affect individuals of all ages but is often seen in younger adults. Bacterial pericarditis is less common but carries a higher risk of complications. Individuals with weakened immune systems, such as those with HIV/AIDS, cancer, or organ transplants, are at greater risk of developing fungal or parasitic pericarditis. The symptoms of infectious pericarditis can vary depending on the severity and underlying cause. The hallmark symptom is chest pain. It's often described as sharp, stabbing, and located in the center or left side of the chest. The pain may worsen with deep breathing, coughing, or lying down. Other common symptoms include fever, fatigue, shortness of breath, and a rapid heartbeat. In some cases, individuals may experience abdominal or leg swelling, particularly if cardiac tamponade develops. Diagnosing infectious pericarditis involves a thorough medical history, physical examination, and several diagnostic tests. A doctor will listen to the heart with a stethoscope to detect a pericardial friction rub, a characteristic scratching sound caused by the inflamed pericardial layers rubbing against each other. An electrocardiogram, or ECG, can reveal specific changes associated with pericarditis. Chest X-rays can help identify an enlarged heart or fluid around the heart. An echocardiogram, which uses ultrasound to create images of the heart, is crucial for assessing pericardial effusion and cardiac function. Blood tests can help identify signs of inflammation and infection, as well as rule out other conditions. In some cases, a pericardiocentesis, where a needle is used to drain fluid from the pericardial sac, may be performed to analyze the fluid and identify the specific infectious agent. While there aren't strict classifications like different stages, the severity and specific infectious agent determine the course of treatment. Some infections are more likely to cause constrictive pericarditis, a long-term thickening and scarring of the pericardium that restricts heart function. Treatment for infectious pericarditis focuses on managing the infection and reducing inflammation. Antibiotics are used to treat bacterial infections. Antifungal medications are used for fungal infections. Antiviral medications may be used for specific viral infections, but often, treatment for viral pericarditis is supportive. Nonsteroidal anti-inflammatory drugs, or NSAIDs like ibuprofen, are commonly prescribed to reduce pain and inflammation. Colchicine, an anti-inflammatory medication, is often used in conjunction with NSAIDs to prevent recurrent pericarditis. In severe cases, especially with cardiac tamponade, pericardiocentesis may be necessary to drain the fluid from around the heart. In rare cases of constrictive pericarditis, surgical removal of the pericardium, known as a pericardiectomy, may be required. Preventing infectious pericarditis involves reducing the risk of infection. Practicing good hygiene, such as frequent hand washing, can help prevent the spread of viral and bacterial infections. Vaccination against certain viruses, such as influenza, can also help. Individuals with weakened immune systems should take extra precautions to avoid exposure to infections. Prompt treatment of underlying infections, such as pneumonia or tuberculosis, can help prevent the spread of infection to the pericardium. The prognosis for infectious pericarditis depends on the underlying cause, severity of the infection, and overall health of the individual. Most cases of viral pericarditis resolve on their own within a few weeks or months with supportive care. Bacterial, fungal, and parasitic pericarditis tend to be more severe and carry a higher risk of complications. Cardiac tamponade is a life-threatening complication that requires immediate treatment. Constrictive pericarditis can lead to chronic heart failure and may require surgical intervention. Recent research is focused on identifying novel therapeutic targets to reduce inflammation and prevent recurrent pericarditis. Ongoing studies are also exploring the role of genetics in susceptibility to pericarditis and the development of more effective diagnostic tools. We hope you have found this information on infectious pericarditis useful. Thank you for watching.